Hi, my name is Colin. I had a scalding injury through working in a brewery in September of 2017. It was very, very strange. Initially, obviously, the pain was a big factor, but the paramedics had dealt with this very quickly. I'd been given, I think, paracetamol, morphine, and ketamine on the site, and was airlifted out of where the accident had happened. Consequently, my mind wasn't exactly focused. I remember distinctly in the helicopter coming over, and I'd had my eyes closed. I was trying just not to look around me too much, but I think because of the drugs, I was kind of hallucinating a little bit. And I remember distinctly thinking I was on Mars, but because of the red from the back of my eyelids, the paramedic kept sort of tapping me and staying in communication, so making sure I was okay and checking in with me. I remember being a bit scared just because I was hallucinating a little bit, and then kept sort of my mind kept sort of wandering away and sort of trying to almost lasso it back in and kind of keep it a little bit, trying to keep some clarity. But then I remember just keeping thinking, this is better than the pain, this is masking the pain. So I was still I was in touch with what was going on. And I remember the paramedic again, as we were sort of coming closer to the hospital, he tapped me on the shoulder, and I looked around, and he said to me, he was like, look, and I was like pointing out the window. I remember that, I can't move my head. Can't move my head, and he kept going, no, look, and I was like, I can't, and he just pushed my head over, and looking out and seeing all the houses that we were just coming down over in the helicopter, and then suddenly just the feeling completely sober again and being back in the real world. But from there, sort of landing at the hospital, it all felt a bit of a flurry. Obviously, there were an emergency team there, took me in to take the dressings off and examine what was going on. I was aware that I was still kind of separated from the pain, and I remember thinking almost like it was an episode of Holby City, like they see you take you out of the ambulance, and all of a sudden there's like a crash team around you, and it felt very much like that. All of a sudden it was just this massive flurry. I was just, my main overriding feeling, I think, throughout all of this was that I just felt really guilty that the accident had happened, and very worried about the stress it would cause my wife and my son, and that was kind of a big factor. I remember thinking that a lot, and sort of just apologising to people loads, coming to the hospital, just feeling really guilty that it happened. I didn't really know. I felt I was going in very blank. I mean, even to the point when we came into the crash room, and then they had taken the bandages off and had started to work on the areas injured. One of the doctors, one of the first time when I was like, do we know how long I'll be or what happened? He said, and he was saying, I think you'll probably be out by the weekend. We'll probably get you out on Saturday. I seem to remember him saying. And there was a great uncertainty as to what was, how severe it was, or how bad the injury was. So I guess they kind of have that mix of sort of people's making their initial sort of, yeah, I think that'll be okay, sort of just initial judgment on it before they sort of got a little bit deeper. My expectation was, I really didn't know. I was very, very, very blank, very confused. I guess with so many things going on, it was difficult to kind of process all of it happening so quickly. A little disorientating, but yeah, just tried to sort of keep calm around it and just roll with it, really. My next memory of it really is they wanted to do skin grafts that day. Yeah, I have a bit of a blank spot basically when the nurses were first taking the dressings off and doing the examination. But I think the pain had started to come back a little bit more at that point as well, but because they were unsure as to whether they wanted to send me down to surgery or not. They didn't want to give me any sort of stronger painkillers. I remember distinctly that one of the main things when he said, right, I think we're going to give her skin grafts. So I said, are you going to put me under general? And they said, they were sort of inquiring as to why, is there anything, are you allergic? And I was like, no, I just don't want to be conscious. I don't want to see it happen. I want to be out. So I guess there was worry at that point as to sort of how serious it was. Obviously at this point I didn't really know how, well, I knew it was bad enough that I had to be airlifted out of work, but I didn't know how serious it was, and I assumed up to that point that this was, hopefully, from my point of view, all precautionary, really. There was a level of uncertainty as to how bad it was, and I guess that was the first point where I thought, okay, if we're talking about skin grafts, then this is obviously quite serious. So there was a little worry about that. I think a little bit of that panic sort of bled into, I'd had sort of brief glimpses at the injury at that point, and I thought if having to go into surgery, if I was awake, that the temptation to look at it would be too much. I wouldn't be able to look away, but really didn't want to see anyone cutting my legs or getting into the wounds. That's all really. So just to worry about that, and I guess kind of a fear that might make me panic a lot. I remember my wife sitting next to me and sort of saying, "Oh, don't look down. They're taking the dressings off now, and don't look at it." So the temptation is always there to look down, but my wife was trying to tell me not to because she could see it was a lot more serious than I could, I guess. But at the same time, like sort of in curiosity, just wanted to know how bad it was. At the same point, and seeing. My first other burns patient who was in the room that turned out would be the one next to mine who had full body burns, and sort of seeing someone else sort of in that state, it was like a bit of a shock. I was pretty scared at that point, really. Obviously his injuries had no effect on me, but I guess at that point you sort of see, okay, he is on the same ward as you, and I've been put, because I could see a scene coming through that there's a couple of shared rooms where there's people on a ward essentially, but I was being moved into a private room, which in one way was a relief, I guess, because I knew I'd sort of have my own space, at least in the short term. But at the same time, I thought, shit, it must be pretty serious. If they keep me away from other people, that means there's obviously an infection risk and other kind of, that it was obviously quite bad. At that stage, the kind of not knowing, I can understand why when you go on a ward, they don't want to sort of give you false hope by saying, oh, you'll be out in 2 days, or, the kind of, everyone's trying to be quite calm and go through the processes to make sure that everything they tell you is accurate. But at the same time, obviously from the patient's point of view, I'm lying in bed going, do you know how I'm going to be here? Do you know what's happening next? Do you know what's going on? And not being able to get a straight answer, it's quite frustrating, which added to kind of the fear of everything else that's happening around. It makes it's uneasy. The nurses were being really, really friendly at that point, just really welcoming, trying to keep me calm. They're being extra nice to my wife. They were really helping her to sort of stay. And she was being really excellent as well. She was being really calming, and she's a bit of a worrier and a panicker usually, but she was like a complete come out of herself and was just being like really, really soothing to me, I guess. So the nurses were just being really extra helpful, doing everything they could to make me comfortable, getting me extra pillows. Just being super friendly. So I don't know, actually. I think I kind of got myself into a bit of a panic about it then. Like, I was very aware on the days when, because you have your dressings changed every second or third day depending on the dressing type, being very aware of who was on the desk that morning or who brought your breakfast out. And not actually trying to sort of go, right, okay, so if Mary did it today, then it'll be Leanne later on, but then it might be, though, if they change the shifts. Trying to sort of attribute space around to it, just because you have the time to sort of sit and think these things over, that you kind of wear it into your brain a little bit. So I remember trying to get myself into a routine on the days when I was having my dressings done, of trying not to do that too much, trying not to panic too much. I remember I became quite obsessed with the Sudoku in the metro, because I used to bring the metro around in the morning with breakfast. So rather than sit and worry about what was going to happen or who was doing my dressings, I'd be like, right, just do the Sudoku and do the crossword. And you get them, that's something to just kind of keep your mind occupied and keep you away from sort of like thinking about it too much. I was really scared in the morning, but at the same time, I was very hopeful that it would ease some of the pain that was going on, and I knew it would help me heal faster. And I was trying to stay focused on that, really, and trying to stay sort of thinking on the positive side of that. I was very nervous and like quite worried about doing it. I knew I was going under a general for it, which I guess in its own way there was a little bit of worry around that. I had no real reason to worry, I guess. I was just, again, because you're kind of spending quite a lot of time on your own in a quiet room, your mind kind of wanders onto all those things, so you do kind of get into a little bit of the panicking about the what ifs or what could go wrong. When they took me in for the skin graft, I was really nervous. It's the odd little things, I guess. It was theatre was only 2 or 3 doors down from my room, so I didn't have to go very far. And I remember being really relieved that I only had to go quite close to where my room was. I don't know why I was so happy about this, but it was I remember that being sort of some relief. And then when going in, I just remember there being so many people around, and sort of like you kind of go in, and I think that in my mind, I thought this wasn't a massive operation. There'll be like 2 or 3 people. There were just loads of people. I can't even remember how many. There might have been like 8 or 9 people in the room. Obviously, there's an anesthesiologist and various specialists and whatnot in the room. I remember just kind of being like, right, okay, there's a lot of people. But they gave me the epidural, and I remember lying back down and just being so delighted because I could feel the numbness just run through my body. And kind of, I guess, through the coping mechanisms, your body just kind of forgets that there's pain there in a way, or has dealt with so much of it that there's so much that it's just kind of like, oh, I just wouldn't think about it. And that numbness kind of riding up through me and just being like, Jesus, this is what it feels like to not be in pain for the first time in like 5 or 6 days, whatever it was by that point. And then I remember, they put a divider between me and my legs, so I couldn't see the injury or see any of the operation going on. But they were like, right, did the sort of the traditional count backwards from 10, and I was out by about 7. And then I remember coming to, and I'd sort of not really been able to move. I was in the room, and I remember feeling quite relaxed at that point and kind of glad it was over. I was still really numb. I think that lasted for a few days actually, where I couldn't really feel my legs very well, but that was a bonus. And then just at that point, very hopeful that if the grafts took well, that it would speed my recovery up quite a lot, and I'd be able to sort of hopefully within the week be able to go home again. I've generally always been that I enjoy going to work. I enjoy working hard. I enjoy kind of being active, and although it is nice to be able to sort of sit down and relax, it's kind of nice to do it on your terms when it's enforced. It was difficult sometimes to kind of deal with the mental side of it, with just kind of the inactivity and not knowing how long you were going to be unable to be down for. There was a particular worry very early on when there was a real uncertainty as to how bad the injuries were. Obviously it'll go through your head at some point, like whether I'd be able to walk again, how mobile I'd be, whether I'd ever have full use of my legs back, like total flexibility, whether I'd be on have to use a walking stick or a frame for the rest of my life. And one of my real concerns was just like when we had a young son, and obviously concerns about whether we'd be able to play football or just run after each other around the park or anything. Just a really deep set worry about that. I guess kind of linked to the guilt that I felt about sort of the situation my wife was in, having to deal with a young child on her own. He was only 7 months old at the time, I think. So that was really hard. I had a meeting with the occupational therapist on my second or third day, and she was really excellent. It really perked me up a lot. I was feeling really, really down and pretty morose at that point. Just feeling I'd let everyone around me down really. That was mentally quite tough to deal with. I think most of my stress was, dealing with the pain was one thing, but I think genuinely the first 2 or 3 days especially, I was really more concerned about the people around me and then what had gone on and how it affected them more than how it affected me, I guess. And the occupational therapist kind of, I was going to say sat me down, but that would be the wrong terminology. The occupational therapist came in to speak to me, and I had a bit of a breakdown speaking to her just because I was sort of in a bit of a down spiral, I think, and she was like, you haven't affected anyone else, that you're the one in here, so you really need to start looking after you and start thinking about that. And that was kind of the first thing that kind of gave me a bit of a shake, and I had to sort of address myself mentally as to how I was dealing with it, and the only way I could sort of improve the situation. There was no point worrying about what had happened or how that affected anyone else. I had to start worrying about myself and trying to get better and how I was going to improve that. Sort of enforced rest is always a bit weird to deal with. It's just like I kind of want to when I have free time, want to go out and do something. Just thank God for Netflix. That really kept me going for that, especially through the first week when it was really quite mentally tough. I could kind of, I guess, a combination of the pain medication and Netflix kind of kept me distracted enough that I wasn't sort of worrying about it too much. I think it was that thing where you feel like you're missing out on something, or feel like you're missing out on life a little bit. And because, like, I couldn't get out of bed, I couldn't even, for the first week especially, like, I couldn't even get up and go and walk around the ward. I was literally bedridden, and that was really difficult to deal with. Just feeling out of control, I guess. And then sort of usually in that sort of situation, be like, oh, I'll just go and have a bit of a walk around, or I'll just go and chat to someone and get out. But I was basically in a room by myself and unable to move really, so that was kind of mentally difficult as well as physically difficult, just being in pain a lot, and I couldn't roll over or move at all really. I was pretty much bound from the hips down, so get involved. I think maybe the first day the physios came along, I was just like, I don't want to be doing this. It's like, these people have been sent to torture me. I think I picked one of the physios out particularly as my enemy. I remember mentally thinking, she is just out to get me, that this is just causing pain for pain's sake. But sort of after two or 3 days of working with them, I started to set myself goals. I remember specifically lying in bed thinking, tomorrow I'm walking to that nurse's station, I'm doing that. And then the day after, getting up and actually doing it and being like, right, okay, this is on now, I am going to get myself better. And that, finding that sort of positive trait in myself was something that I'd never, not that I never thought I was capable of, but I've never sort of been that sort of where I've set myself goals and been, right, okay, I'm going to do that, and then come back feeling really good about it and thinking, right, okay, right, that's what's next, what do I do next, and then being, right, I'm going to make it to the end of the corridor tomorrow, and then the day after that I'm going to do a lap of that block, and then the day after that I'm going to walk up to the exit away off the unit and come back down, and really using those goals to, like, basically mentally to drive myself on. And I think a big part of that was thinking about my son as well, and just thinking, I'm going to make myself get better so that he isn't affected by this. That was all I was really concerned about. I suppose one of the things that I kind of beaten myself up about a little bit was sort of how guilty I'd felt because the injury had happened through essentially something that was my fault. Well, I could have prevented it really. But to have like some friends come over and just like completely non-judgmental about it, and we're all really just like, you're our friend, you're in pain, we've come to help you out, and that was good. It was really buoying actually to have to sort of know that. I think sort of in the industry we kind of think we've got a lot of friends and whatnot, but it's kind of, a lot of it is kind of superficial because most of the time we get together it's over beers or down the pub or whatever. But yeah, they went out their way to come and see me. That was good, and mentally good. I think especially towards the end of my stay, it was when I was sort of setting myself goals and trying to drive myself on a bit, to sort of know that the people had my back, and people who maybe even like some people I hadn't spoken to in 5 or 6 years got back in contact, and I really did feel supported. And on both nights I had a migraine after they left, and I put it down to because I was going through the rehab, because I was on my feet and trying to drive myself forward a lot, and then was with Vicky and my mum, my wife and my mum during the day, and then with them in the evening I was just exhausted, to the point where like my boss at the time messaged me one night to say, oh, do you mind if I come over in the evening? And I was like, I'd rather you didn't. It's not that I don't want to see you, it's just that I'm exhausted, and like the rehab's really taken out of me at the minute, so I'll come over and see everyone when I get back, but I really need to concentrate on this right now. I was nervous. I was really relieved just to be able to go home and just like see my dog was like one of the main ones. I think I only cried 3 times when I was in hospital, and 2 of those were, one was a photo of my dog, and the other was my wife telling me about my dog sitting by the window waiting for me to come home. So I was really, that was kind of my main thought, was I wanted to go back and see her. That was one of the pieces, and just to kind of feel a bit more comfortable and just kind of be in sort of my space really. And we really loved our house in Derbyshire, and it was just one of the things you kind of just like miss, sitting on your sofa or being able to just go and make yourself a cup of tea. I was nervous as well, just about how finding the challenges of that, and just not being able to kind of, I was worried specifically that I wouldn't be able to get upstairs, just to the bedroom. The toilet was upstairs, and I was like, will I be able to get up there? So the toilet downstairs was very small, so like even when fit and able, it was a bit of a squeeze to sit in there. So I was like, oh, am I going to be able to bend my legs enough to actually sit at the toilet? funny little things about just not how the space would be, and if, like, whilst I was in hospital, if the pain got really bad or I woke up in the night and I couldn't sleep or anything, I could get a nurse and call for some morphine, or I had options of that, and how I just concerned about how I was going to cope with all of those things. One of the other concerns actually was related to my dog as well. Just, she's quite jumpy. I'm just thinking, when I get home, she's going to jump up on my legs, and how am I going to cope with that? How am I going to keep her down? The little things you kind of get a little bit paranoid about, but she was amazing. Like, we got home and she didn't jump at me at all. She came and stood next to me, just walked alongside me into the living room, and just came and sat on the sofa next to me. And that was pretty magical, really. But yeah, I think that there was a lot of nerves about it, but I was just excited to kind of be back in my own space and start trying to live in the real world a little bit, and like just try and get things back to normal. Especially, well, the first, I was treated as not an outpatient, but they'd held my bed essentially for the first week that I was out, in case I decided that it was too much, or if anything had gone wrong, then they could basically readmit me without having to sort of wait for someone else to clear off. So the first time I came back was odd, because I came back on the ward and the same guys were still, there was only 3 days, I think, or 2 days after I'd been out. But there was like, oh, here he comes, Mr. Wiping outside now, and there was kind of some jokes around that. I was really well looked after again. They basically, all I was going back down for essentially to be bathed and to have my dressings changed. It was a bit of a trek. I think one of the main concerns I had about doing it was because we lived just over an hour and a half away. Essentially for what would be an hour and a half's appointment, but I think it really helped both my health development and just kind of mentally, just being in my own space and kind of having that time, even with sort of the 3-hour drive around it every other day to come and have the dressings done. I think it was really positive to have that, and the team at the hospital was still really supportive. If I ever needed anything, kind of communication was good, and they were really helpful about just trying to make sure I was getting the best care possible. It was worrying. Well, I was really nervous about it though. Like, the sort of, I suppose discussion had been like that I wouldn't be able to wear shorts for a long time, just to keep the sun off more than anything, because the skin be really fragile. But I can't remember thinking I wouldn't want to wear them anyway, because like my legs looked really weird. Well, when I first came out, I think we described it as lizard skin, but they looked scaly, because of the grafts. And there was a lot of open wounds on them and things as well. But obviously the compression dressings helped with a lot of that, but when the dressings started to come off, it was a bit of a worry. I was starting a new job at the time as well, and I wasn't very mobile. The skin was still quite tight and young and very fragile as well, so I had to be really careful about where I was, and like I was really paranoid for the longest time, just about even going into like crowded areas, going to the supermarket in case someone banged into me with a trolley, or in case someone just walked into me and kicked me by mistake. I think I had just needed to open up a little bit. I'd been just all of the negative stuff that was going on in my head, and all of the kind of the ill feeling about the whole situation. I hadn't told anyone about it, or I hadn't really sort of in any way engaged with anyone about that. And like the people who were coming to visit me didn't want to ask, because it's like, oh, he doesn't want to think about that. He wants to like think about more cheery things. But she actually directly just sort of made me speak about it a little bit, and even though it was hard to do initially, it really made me start to think about what had happened and how I was going to deal with it. Just a sort of a baseline feeling of trepidation about just kind of going out, about kind of seeing people, about being in crowded areas. I thought initially I wasn't that worried about sort of being around liquids or heat again, but it turned out going back to the brewery, for the first couple of weeks I was kind of jumpy about it. I didn't like going down to the brew house at all. I didn't like being around the brew area, and even like if I saw someone emptying the hot wort out of the copper, I would get a little bit, okay, just gonna go back upstairs and sit down now. Being just sort of hyper aware of people around me with like cups of coffee or just busy areas, because I didn't know like that people might bump into me, or that I might get just knocked by mistake, and because the skin was so weak that it would tear again, or just that like people were carrying coffee or something and might trip and spill it on me. So there was just like a baseline sort of paranoia and low level worry. I figured at the time that it was probably something that would pass. I tried to focus on not giving myself a complex about it and not sort of worrying about everyone I see. Initially, I thought, I'll just deal with it. I'll just roll through it. You kind of realise a little bit of time in that it's possibly not that simple to just deal with yourself. Sometimes you kind of need to take a fresh look at it, and it's not always the easiest thing to do. Initially, it was really odd whether I personally got like a stigma against that in my head, or I think my concern was that other people might think I was mad, essentially. I remember actually saying that to a friend of mine who asked how I was getting on. I was saying, like, I'm having to go to see a psychologist. I'm not nuts, but I just need to go and I just need to talk to someone about this, basically. So in a way, there was kind of a challenge for myself there to sort of just break that stigma in my mind and just kind of normalize myself around it. And the first couple of sessions were really hard as well, just kind of opening up about stuff that you've kind of sort of squirreled away into a little corner, and sometimes maybe just thought, yeah, I've kind of got rid of that because I don't really want to think about it and I don't really want to have to approach it. And, we'll just try and forget that happened. And you were never quite sure, like, I don't think it, to a point, I'd even associated it with the accident at that point. I think I just thought I felt a bit unwell, but yeah, I think that was one of it was sort of a difficult thing to do when it probably shouldn't have been. It actually turned out to be quite easy and quite an enjoyable experience, really. Something that really helped me work a lot of stuff out and helped me sort of try and get things back on course and go back in the right direction. But initially, yeah, it was very difficult to kind of mentally just to allow myself to do it, or to think, not to hold any sort of negative stigma about doing it. I think I probably learned that I'm a little bit more multifaceted than I'd given myself previously credit for. I think I'd always just been like, right, okay, I'll just get on and do things in a very sort of head down, gung-ho kind of fashion, just to always kind of pushing things forward. And I think one of the things that it kind of opened up to me was that there are a lot of ways I can approach problems and a lot of ways I can kind of deal with things. And I've definitely found that sort of in my general life that I've kind of started to use that a little bit more. And I think probably that I'm a bit more resilient than I thought I was. Like I say, when I first went in the hospital, I was very concerned about sort of seeing the wounds or anything. But now it's like I get the photos out of parties. The sort of almost are like, see what happened to me a couple of years ago. It's good times. It helped me sort of appraise some of the things that are more important to me as well. Like how much I was worried about my wife and my child when I was in hospital, and when we came out, how relieved I was to kind of have them all around me. I think maybe up until that point I was probably a little bit more selfish than I am now, and I think it kind of had helped kind of just snap me out of that a little bit and kind of think about the things that are important around you, and then just to generally be a little bit more careful, a little bit less instinctive about just kind of diving into things and right, okay, next, let's just do this, that feels right, we'll get on with it. And just being a bit more thoughtful and a bit more careful about how I go about my business, really. Hold on in there, it was a big one. I think from my initial experience was just worry and panic that I'd maybe injured myself to the point that I wasn't going to be able to sort of come back very easily from it, and I did. Like, my skin's nearly fully healed now. It's still a little bit weak, but it's healed a lot more than I thought at some points maybe it would. Use the treatments that are available to you to the best of your abilities. I can't recommend enough how much just moisturising and just looking after the skin after the injuries really, really helped. I had a spell a couple of months ago where I kind of backed off a bit. I thought, I'm probably mostly healed now. And within like 3 weeks, just had like a string of open wounds on my leg again. Be aware of the mental side of it. I think that's the hardest thing. Like the scarring's easy for everyone to see, and sometimes the mental scarring's a lot worse. And just be aware of that. Make sure you treat it. Make sure you do the best by that, because that could be the long-term damage, I guess.